I want to take this now opportunity to start the program with introducing Dr. David Rosmarin. Dr. Rosmarin is an assistant professor in the Department of Psychiatry at Harvard Medical School. He is also the founder and director of the Center of Anxiety, which has offices in Manhattan, Brooklyn, and Rockland County, and is one of the largest providers of private pay psychotherapy services in the greater New York area. Services more than 500 new patients each year. Dr. Rosmarin is a board-certified psychologist and is a prolific researcher and author of 60 reviewed publications, 100 scientific abstracts, and the recent book entitled Spirituality, Religion, and Cognitive Behavioral Therapy, a guide for clinicians. His work has received media attention through ABC, NPR, Scientific American, and the Wall Street Journal, and the New York Times. Without further ado, it's our great honor to introduce Dr. Rosmarin.
Thank you, Rabbi Silver. I really appreciate it. And I have to say, seeing so many people here tonight is definitely making me a little anxious. In all seriousness, it's really a pleasure and a privilege to be here alongside Rabbi Shapiro to speak about managing anxiety in parents and children. And thank you again, Rabbi Silver, also Mrs. Werblowsky, for inviting me to be part of tonight's event. More broadly, I'm very grateful for the tremendous work that Madraigos does here. 50% of the patients who come to my offices in New York, about 50% these days, are from the Orthodox community. So I can personally attest from my vantage point, and many of you can here as well, that Madraigos is changing the emotional and spiritual landscape of the 5 towns and surrounding areas every single day, and actually saving lives. And I'm not speaking with exaggeration. Whenever we have teens or young adults who are referred to us from this area, one of the first questions that my clinicians that I train them to ask is, are you plugged into Madraigos? And there's reason for that. So thank you. Okay, the focus of tonight's event, managing anxiety in parents and children. It could not come at a more appropriate time. It's very clear that we are living in an age of anxiety. I'm going to provide some context about how anxious our world is today by citing some statistics. The first statistics are going to come from the National Institute of Mental Health. 19.1% of adults cross country, it's nearly 1 in 5 adults, has a full-blown anxiety disorder. That's in every given year. That's just 2018, and 2019 is probably going to be higher. 3 years ago it was 18.1%. Furthermore, nearly 1 in 4 of those cases, 22.8%, is a severe case of an anxiety disorder. So that's about 1 in 20 Americans each year has anxiety that's so high that they're actually incapacitated, or maybe even worse. That's only in every given year. Over the lifetime, 41.7% of Americans, everything cool? Great, you make me nervous. Over a lifetime, 41.7% of Americans, that's more than 2 in 5, will have a diagnosable anxiety disorder. That's, like I said, 2/5 of the population. That's the National Comorbidity Study, which was done by Ron Kessler and colleagues in my department in Boston. But that's adults. Young people, it's even worse. I'm not done yet with the bad news. Among primary school kids, little kids, the estimates vary, but the studies suggest that between 5 and 10% have significant anxiety. That's 1 in 10 to 20 kids. But teens, it's worse than that. There was a recent study that showed that nearly 1 in 3, 31.9% of teenagers has an anxiety disorder. So if you have a high school class of, say, like 30 kids, that's 10. 9 to 10 of them. But the highest risk is among young adults, college students. Earlier this month, there are some colleagues of mine in Boston, the Harvard Medical School, and they published a landmark study. There were 65,000 students that they sampled from 108 college campuses across the United States. What they found is that 1 in 4 students had received treatment for an anxiety disorder or related condition in the last year. That's not surprising based on what we saw. If anything, it seems a little low. What was shocking, though, is that 1 in 5 of those students were engaging in self-injury to cope with negative emotions. Self-injury involves the intentional destruction of body tissue for non-culturally sanctioned reasons. In other words, not ear piercings and tattoos. We're talking about people cutting, burning, or worse in order to cope with negative emotions. That's 1 in 5 college students these days. And worse, most shocking of all, a similar number, 1 in 5, had seriously considered suicide, and nearly 1 in 10. The number was 9% that had attempted suicide at some point in their lives. These are people in their prime, 18 to 22 years old. Now, people ask me all the time, well, what about the Orthodox world? Aren't we different? Well, to some degree. My colleague Steve Piratinsky, who's at Touro College now, and I have published more than 20 peer-reviewed scientific articles on mental health, and a lot of them pertaining to spirituality as well, in the Orthodox community. We've found that Orthodox Jews do tend, on the whole, to fare marginally better than non-Orthodox Jews and than people in the general population. But there's still substantial cause for concern. In a recent study we did with 400 Jewish individuals from the United States and Canada, 21% of Orthodox Jews, 1 in 5, were taking some sort of psychiatric medication. It was a little bit higher for people who were what we call Bali Tshuva versus FFBs, BTs versus SFBs, right? People who grew up Orthodox, the number was 19%, and people who grew up non-Orthodox and later became or converted, whatever, to Orthodoxy, the number was 27%. Among non-Orthodox Jews, the number was 29%. But we're still looking at least 1 in 5, is that right? Yeah, 1 in 5 of individuals. So these trends are absolutely shocking, and they keep me busy day and night. But more importantly, they're bizarre. If you think about it, just step back for 1 minute. In truth, we have fewer reasons to be anxious today than ever before in human history. Globally speaking, and especially in the United States, we are wealthier, we are far more technologically advanced, we're more productive, more connected, and more comfortable than ever. We are the most privileged human beings ever to walk the face of planet Earth. Think about it. Are there any people in your community who do not have indoor plumbing? Can you think of one person? How about somebody who has never benefited from a modern medical technology? They've never been to a doctor's office, they've never been to a hospital. They've never seen a stethoscope. I don't know anyone. Even further down, let's up the ante. Can you think of one adult over the age of 18 who has never been on an airplane because they couldn't afford a ticket? It's incredible, the world that we live in. It's unbelievable. I'm not saying that there's nothing to be afraid of or upset about today, but it's really odd. It's really strange that the most privileged people to ever walk the earth are more emotionally distressed than anything in history. It's like nothing else is coming to get us, so we have to get ourselves. We're our own worst enemy in this generation, no question. But even more strange, we have so many different psychiatric medications today. They're actually divided into categories. There are like 6 whole categories of medications, not just 1 or 2 meds. There are antidepressants, there are anxiolytics, which are used for acute treatment of anxiety. There's antipsychotic medications, which are now becoming almost ubiquitous, even for treatment of depression. Don't get me started. There's stimulants, there's mood stabilizers, and that's not even pain medication, which often has a very strong psychological component. And the medications, it's not like just a couple of people are using them. Each year in the United States, there are 50 million prescriptions for Xanax, just Xanax. And if you combine Lexapro and Celexa and Prozac and Zoloft, your go-to 4 SSRIs, serotonin reuptake inhibitors, those are the antidepressants, 125 million prescriptions. There are only 330 million people in the country. Did you know 5.2% of US children, that's more than 1 in 20, are on medication for ADHD? And in all, 25% of this country are actively taking medication at any time. So here's another question. If so many people are taking medication to control their moods, then why are we more anxious than ever? Is that a good question? Okay. What's going on? What's going on in this world that makes it such a ripe context for the development of emotional instability and high anxiety in children and in parents? And most of all, what can we do about it? Well, before we address any of that, I want to define some terms and make sure that we're all on the same page. So what is anxiety? How is it different from fear? And what does it mean to have an anxiety disorder? So let's start with fear, because that's, well, the easiest. Fear is a natural and healthy reaction to a perceived threat. If I took a foghorn and went, everyone, well, what is that? And that's fine, that's healthy, because when your body's perceives something that's out of the ordinary, we have a system in place. It's called the fight or flight system. And that summons these internal resources that we have to maximize their chances of survival and minimize the chances of being harmed. And that system starts with actually with their adrenal glands, which are sitting on top of your kidneys, ready to fire at any time. That's their home. And when the adrenal glands fire adrenaline into the bloodstream, it triggers this cascade of physiological responses, including increased circulation of oxygenated blood through your body, lots of good blood pumping through, increased oxygen intake, so people tend to take in more air, increased muscle tone. In fact, neural control of fast twitch muscles, say that 10 times fast, it increases when people have an adrenaline shot. There's diversion of blood from the extremities to the vital organs inside the torso. The digestive system tends to slow down a little bit. And also the visual system, the eyes, the pupils dilate, which increases our sensitivity to light and also our field of perception. So we're better able to see things. In other words, you're getting mobilized to be able to, I guess the modern equivalent is like, get out of the way of an MTA bus when it's coming at you, down Fifth Avenue at 60 miles an hour, which happened to me once, let me tell you. In other words, when your adrenal glands fire and they're triggered by this perceived threat, you actually become a superpower, Superman, Superwoman. And that's a good thing. We want it to happen. They're very healthy responses. People who don't have an adequate fight or flight system, they don't have enough fear, well, it's an indication that something's actually very wrong. And in modern medicine, there's something called the Moro, we talk about the Moro reflex. Shortly after birth, neonates are tested for the Moro reflex. Sometimes a loud noise is used, sometimes they'll lift up the baby and just have them drop down a little bit, talking 3-4 inches, that's all that's needed. It's called the startle response in English. And it's a natural reflex. It involves the baby throwing back its head, and it extends out its arms, and it starts to cry a little bit in the presence of a fear, something that makes it afraid. And if the baby does not have a Moro reflex, if they don't have a startle response, then immediately the neurologist is called in, the pediatric neurologist is called in for a consultation, because it's a sign of potentially very severe damage to the spinal cord and or the brain. So what we're learning here, I'm trying to teach you over anyway, is that fear is not bad. The problem is anxiety. Now, what's anxiety? Anxiety is the experience of fear, a fear response, without a threat being present. I'll say that again. Anxiety is the experience of a fear response without a threat being present. It's the adrenal glands firing even though there's no reason to be afraid. It's a false positive. All of the physical symptoms of fear, all of the physical symptoms of anxiety, the things that people come and complain to me about day in and day night, in fact, they map precisely onto those physiological changes that people experience when they have the fight or flight response. I was just speaking about a couple minutes ago. The heart palpitations. People come in like, my heart's racing, I think I'm going to have a heart attack. Well, why is their heart beating really fast? To get the oxygenated blood pumping through their system. Now we hop, right? Now it makes sense. The shallow breathing. I can't breathe. I feel so short of breath. I can't catch my breath. It's so hard for me to do. Why? Because you're trying to take in more oxygen, and your body is trying to regulate itself. It's as if you're under threat, and your body is perceiving a threat, and your body is doing a very healthy, normal thing. It's just doing it in the wrong time. The muscle tension. Oh, I'm so tense. I can't believe it. I can't even get to sleep. My neck, my back. That's because your physique is being mobilized to cope with the stress. That's the mobilization, the fast twitch muscles, muscles are getting mobilized. Some people have numbness and tingling in their fingers and in their toes sometimes. And this is a weird sensation. People come in, I don't know what's going on with me. I think I'm going bananas. I can't even feel my fingers. Well, that's because the blood is being diverted to the torso in order to keep it by the in order to power your vital organs. The stomach upset, right? Rumbling tummies, diarrhea, whatever it is. The digestive system is slowing, and some people have this dizziness or an out-of-body experience, and that usually has to do with the pupil dilation suddenly, and they're having increased sensitivity to light, and their pupils are dilating, and it throws them they become dizzy. It throws them off their game. So that's the reason why people have anxiety. It's a false response to perceived fear, but it's not really there. So fear is good, and anxiety is, I didn't say good or bad, I'm going to say it's unnecessary. Anxiety is unnecessary. However, in this day and age, almost everybody experiences fear at some point, and if you don't, then, well, we probably have to speak, or definitely have to speak to your doctor. But anxiety also today, almost everybody, as we spoke about a couple minutes ago, is going to experience some level of anxiety in life. Part of being human is that we're not perfect. And once in a while, your adrenal glands are going to fire a false positive. And they're going to activate even though there's no reason. And it doesn't mean that you're broken, and it doesn't mean that you're destined to live a miserable life. Especially in this day and age, it's just a reality. Sometimes you're going to wake up and feel a little anxious, or sometimes you're going to be going to bed and feeling a little bit unnerved, and it's not really going to be for any reason except for the fact that, well, you're a human being and you live in 2018. In fact, there are even some benefits to anxiety. People with greater anxiety tend to be more attentive to detail, tend to be more sensitive to their environments. They might even be more sensitive in relationships, although I'm not sure about that, but it's possible. The problem is when anxiety causes people what we call significant distress or impairment. In other words, if your anxiety is something that's upsetting you at any level, or if it's causing you harm in some way or making it hard for you to live your life, well, that's a problem. At that point, we would say somebody has an anxiety disorder. And this is important. Everybody in this room and everybody you'll ever meet can tolerate different levels of anxiety. Some can tolerate more and some can tolerate less. And what constitutes an anxiety disorder for one person is not what constitutes it for another. And just being labeled with a diagnosis doesn't necessarily mean anything in of itself, except for the fact that you, at whatever point in life, are struggling to cope with a certain level of anxiety. That's really all it means. Having anxiety, and I want to make this point, having anxiety and anxiety disorder is not like the measles, bad example today, it's not like the mumps, it's not like the measles, it's not like the mumps, it's not like, there are no lab tests. People say, well, what about a brain scan? Can't you tell me if you put me on an MRI? And the answer is no, I can't. There's some neural signatures of anxiety that we see, greater connectivity at resting state, whatever, but it's not like there's definitely not a lab test. Higher blood pressure maybe, right? But it's not, there are people with high anxiety who have low blood pressure. So it's not like, yes, you have it or don't, no, not. The way to think about it, the way we think about it in my office anyway, is that everybody is on a long spectrum. There's a long spectrum of anxiety, a dimensional scale. And everybody is at some point along that scale. And that shifts. At some point, when it gets to a point that it's causing us significant distress or impairment, we can arguably say we have an anxiety disorder and we need help. So in these regards, it's much less important whether somebody has an anxiety disorder or doesn't. It's important how much it impacts you. And it's important how much distress you're experiencing from it. I've seen people who have had one panic attack and they are in bed for a month. Well, that's a problem. Technically speaking, it's not panic disorder, because you have to have 2 panic attacks in order to have panic disorder. I've seen other people who are panicking 4 times a day, vicious, horrendous, horrific panic attacks that I couldn't tolerate half of one. And they're walking around and they're actually doing okay. So I've seen it. Not everybody is impacted by the same level of symptoms. There's the anxiety, and then there's the sensitivity to our anxiety. The latter is more important than the former. So yes, it's a problem in our society that we're shifting towards greater anxiety. But the bigger issue is that we're shifting towards greater dysfunction. The worst part isn't that there are more diagnoses. The worst part is that there's more self-injury, there's more suicide, there's more people who are having severe symptoms that they can't function day to day. There's more people who are upset and bothered by the fact that they're experiencing anxiety. And that's really my job. So let's get back to our question. Why? Why are the most privileged people on earth the most emotionally dysfunctional? Now, I don't know for sure, but I'll give you from my vantage point a couple of things that I see. Systemic factors in American culture that are creating or at least exacerbating a mental health crisis which is enormous. One key factor is that our culture is obsessed, we are obsessed with minimizing uncertainty. I'll say it again, don't worry. Our culture is obsessed with minimizing uncertainty. We have predictions for almost everything. Financial markets, political elections, you saw this week, flu epidemics, professional sports outcomes, and the weather. And we're glued to our televisions and our devices we wait with bated breath, like what's going to be the prediction. We study them like a daf Gemara, and we monitor them, day in and day out. We can't tolerate uncertainty, even though almost always the predictions are dead wrong. We prefer to be wrong than to admit that we don't know. We don't like not knowing. We always have to know what's happening next. Where's the piece of, there's always information that we have to get. We're also very risk averse. You know, in the 1950s, 22% of this country had dire poverty. And today, the rate is less than 10%, which is still a national problem, but the median income for families in the United States is $60,000 US a year. And over 90% of Americans have health insurance. But we helicopter parent our kids because, like, no, they can't, you know, have a bruise on the playground. Not just through grade school and adolescence, but in their early and even middle adulthood to make sure that they don't experience setbacks. Why are we so overprotective and intolerant of uncertainty and risk averse as a culture? Well, I think really what this all boils down to, and perhaps Rabbi Shapiro will speak about this later, I would bet, is control. Sorry if I just committed you to something over there. It's all about control. We are obsessed with control. Our economic and our educational systems are all set up to reward achievement in what we do as opposed to the process of achieving or striving. We always value the end goal and not the process of getting there. Kids are typically rewarded for performance on a test, not trying their hardest. And the reason why is because adults, parents, educators have a greater control when we predefine an outcome and we spoon feed a kid the answer. Because as opposed to letting them flex their own muscles and come into finding their own way in life. It's very scary for a parent or an educator to give up control and say, do your best, find your unique path in life. Because we don't have control over that anymore. And the child can say, I did my best and this is who I am, and then we actually have no recourse. And you have to give up and actually let the kid be who he or she is. So we have this cultural need for control. And it's so apparent in our relentless pursuit for success and happiness. We have these cultural icons, and even in our communities, they're famous and financially successful, and we worship them irrespective of whether they actually exerted themselves or really are being unique human beings, and irrespective of how they are in their personal lives, although that's another schmooze. Again, we value the outcome, not the process. Similarly, we're allergic to having intense emotions for this reason. Intense emotions are scary. And intense emotions remind us that we're not in control. And everybody in this room is a human being, right? Raise your hand if you're a human being. Okay, so if you have never had emotions that are out of control, then you will, or then you're not aware of it. Probably more the latter, or both. But we're so allergic to having intense anxiety or sadness or difficult struggles with our emotions. Because normal mood fluctuations, just having ups and downs, they're perceived as a weakness. And there's something to be avoided. And we value suppression of those emotions. Choke it off. Don't show it. For sure don't show it, but don't even experience it. In fact, if you're having anxiety, something's wrong with you. And if you're feeling depressed, then clearly your mother did something wrong. And we medicalize these. We call them chemical or biological imbalances, and that people are disordered and diseased. And when our emotions just don't fully cooperate with what our expectations are. We have these expectations of our emotions to be even-keeled and in check all the time, and when we don't feel the way we think we should, then we label ourselves as sick. Well, then what do you think happens to your level of anxiety? Of course it's going to go up, and your level of depression. Listen, it's been great for business, but please, help yourselves. It's true that I don't want to minimize the fact that a lot of people do have debilitating and intense distress. And when that happens, of course, it's critical to get help. But on the whole, we have completely unrealistic expectations about how we should be feeling day to day. And then when we become more fearful of our anxiety, that just makes the situation worse. 25% of Americans are taking psychiatric medication. That's not just on the fringe. That's a cultural shift that we're seeing today, that people can't tolerate a lack of control. I want to clarify. Yes, it's reasonable to want to be happy. Pursue equanimity, sure. But ironically, if we pursue it relentlessly and we avoid anxiety and pain, the harder it is to live in peace. The more we can accept that normal mood fluctuations and anxiety and depression and other things as well are just part of life, the more we can get on with the show. There's another piece here, which is judging other people who are as other people for being anxious, as being broken or disordered when they struggle with their emotions. I was in Washington, D.C. at SAMHSA. It's what's it stand for? Some administration, some government office that deals with mental health and substance abuse. In fact, I think SA is substance abuse and MH is, anyhow, whatever. It's known in Washington, D.C. that mental disorders are the no casserole disease. They call them the no casserole disease. Why? Because when people get cancer, then neighbors and friends bring over dinner. But when somebody has depression or anxiety, there is no lasagna. So instead of accepting people and embracing them when they need emotional support, we shun them. And we act all weird. Like, should I call? Yes, call. Be nice. They are going through a hard time. Say hello. And I think the reason is because when we see other people struggling, it reminds us that we're not in control of how we feel. And that's really, it rubs against the American sensibilities. And don't even get me started on shidduchim. Should I get on my soapbox for a minute? Bershus harav, bershus haravanim? All right. So I'm only going to say this. Our community expectations are completely unrealistic. And we pretend to be perfect, we pretend to marry perfect, and instead of acknowledging and dealing with emotional and behavioral shortcomings, which are just part of life. The reality is that all human beings have something to deal with in life, some internal set of patterns of thought and behavior that we need to correct. In fact, I would even wonder from a spiritual perspective, and now I'm overstepping, whether that is our purpose in life to correct those problems, those issues in our life. I'm seeing half of a nod from Rabbi Shapiro, so that's good. That's life. When we pretend to be perfect, the problems continue to grow. They undermine our spiritual well-being, they undermine our emotional well-being, and they undermine our families, and then we end up, well, where we are. Okay. What do we do about the anxiety epidemic? The number one piece of advice I can give you, standing on regalathas on one foot, is this. Face your fears. Face your fears. Facing fears, and I'll explain what it means, it's the key ingredient in the gold standard treatment for anxiety disorders, which is also known as exposure therapy. It's a variant of cognitive behavioral therapy, specifically behavior therapy, in which we help individuals to overcome their distress by systematically confronting what makes them anxious, head on, no Xanax. I was kind of joking about the no Xanax, but it is. In exposure therapy, it's head on, no question. The antidote to anxiety, you want to know? Accept it. Stop fighting it. In fact, face it. Run towards it. Run into the fire. Anxiety gets worse when we fight it off. It gets worse when we try to avoid it. And when we stare our worst fears down and we run towards it and we tolerate uncertainty and we accept that we are not in control, poof, it goes away. It's the scariest thing that a person can do and the most rewarding. I'm going to give you some examples. Years ago, a rabbi friend of mine called me up. He confided in me. He's like, you're a psychologist who deals with anxiety disorders? I'm like, sometimes. He says, well, I have a fear of heights, and I'm really embarrassed about it. I'm like, don't be embarrassed about it. Either deal with it or don't deal with it. He's like, okay, I'll deal with it. What do I do? So I said, great. Go up to the highest point that you could possibly think of. I want it to be a place that has straight views down hundreds of feet. I want you to peer over the edge. I want you to lean over with 1 foot. He says, why on earth would I do that? What if I have a panic attack? So I said, great, you'll have a panic attack. You'll just let it go. Let it ride. Let yourself panic. Let your anxiety wash over you. Accept it. Don't fight it. Give up. He said, you're crazy. A year later, I get an email from him. And he said, I just came back from a trip to San Francisco, and I took the chance to face my fear. Finally, what you told me penetrated. And I went over the Golden Gate Bridge, and I was on foot. Actually, I think it was on a bike. I was on a bike, and I was looking over the side of the rail the entire time, and I was shaking, and I thought I was going to crash my bike into the side, into the rail. But in the end, I had this wonderful sense of calm and this fulfillment because I'd stood up to my fear. I'll give you another case, more complicated, much more complicated. Single, frum female, late 20s, came into my office, very significant OCD. She literally could not go to the supermarket. She's a girl from Brooklyn, and the last time she'd been to Pomegranate was 2 years ago. She had these unrelenting obsessions, which she knew were not sensible. This is obsessive-compulsive disorder, that she might have a brain aneurysm. And yes, she had been for neurology consults, and no, there was no indication of a brain aneurysm. So she has anxiety or fear. Quick. No, not fear. Anxiety. Good. Okay. Fear would be if she does have it. Right. Okay. And she thought, oh no, if I go to Pomegranate, if I go to the supermarket, I'm going to have those symptoms again, my blood pressure is going to increase, and then my brain is going to explode, which would be bad, so I'm going to avoid Pomegranate. So she noticed she was feeling very anxious there, so she's just like, I'm just going to avoid my whole life. And she did. She hadn't been there in 2 years. She never went on dates. Why? Because she might have intense emotions, and then her brain might pop, which would be bad. So she couldn't tolerate this uncertainty that maybe she might have an aneurysm and die. But that was only the beginning of her anxieties. When we mapped out her obsessions and her compulsions, we came up with 70 examples that were plaguing her every single week. Unrelenting anxiety thoughts and behaviors that she was engaging in on a weekly basis. I said, you realize if you're going to get over this, and if I'm going to be involved in this treatment, this is not going to be fun. So she said, I'm in. I'm like, you sure? She's like, I'm in. I pushed her unbelievably hard. She was amazing. She faced every single one of her fears. Now, at one point, I sent her out of town without her cell phone to a city. Nobody in her family knew where she was going. I didn't even know where she was going. And she was terribly afraid. She'll go up in an airplane. She went in an airplane. And there's going to be pressure on the airplane. She might die. Nobody's going to even know. So I quit with her during session. I'm like, well, if you die, eventually we'll find you. Because we'll have your ID. And I'll come to your funeral. She's like, do I really have to face it that much? I'm like, yeah, you do, if you want to get over this. I was unrelenting. She had religious obsessions and compulsions. We faced every one of those too, with a psak from her Rav, of course. That gets really interesting. That's another shmooze. And she embraced the possibility of her imminent death every single day, multiple times a day. And she said to me, this is the hardest thing she's ever done. And it took over a year. And in the end, literally OCD-free. Not only that, married, 2 kids, perfect life, right? Not quite, but she's doing extremely well. And she accepts herself when she's not perfect. She's had some periods of anxiety since, and I don't hear from her then. You know, she manages without it. I have more examples. How much time do I have? I'll give you some more cases. When people have worry, they come to me with chronic worry. So what do I do to them then? Any guesses? Do I get them to worry more or less? More, of course. I want people who come in with chronic worry to detail their worst nightmare and to write it down. Sometimes to even say it over and we'll record it and have them listen to the worry speech that they said to themselves for 5 minutes every single day. It's interesting. People worry actually to modulate their anxiety and keep their anxiety at low levels. The reason why we worry is they have the same thought, what if, over and over again, and we don't actually answer the question, what if, which would be so terrifying. So I actually get people to really face their fears. But once they let go and embrace uncertainty, then their anxiety goes away. Panic disorder. Well, we have ways in our office to trigger people having panic attacks. Isn't that fun? Spin them around in a chair to help them become dizzy. We have them breathe through these little straws to constrict their breathing. We have them run up and down stairs to get their heart pumping. And our goal is to help them to have the courage and the stamina to completely lose it in my office. And once they let go, and once they panic, and once they see, even though it just washed over me, it didn't destroy me. And I can let go, and I can actually be okay. There are a lot of other examples, but the method is really simple. We help people to embrace the unknown. We help them to give up control and to accept that their emotions will sometimes get the better of them and that they're not broken, that we are not broken just because our emotions sometimes wax intense. And the rationale is simple. We're human beings, and we're not supposed to be in control. So let's accept that. Now, kids and teens, it's part of the talk here, so how does it work? It's basically the same thing, but there's really one difference, which is that children need their parents to be involved for exposure therapy to work. Most of all, parents have to let go and let their children experience anxiety. They're always saying, what if my kids get anxious? Well, yeah, they're going to get anxious. And what if they do this? Well, they might do that. And not to bail out the kid. It's hard to watch when kids suffer. And I'm not saying to cause them gratuitous pain, but letting kids tolerate uncertainty and to come to a point of acceptance and to come into their own place in life, that's how they can overcome anxiety. So we always instruct parents when the kids are in treatment not to accommodate the kids' anxieties. Parents should be supportive and kind and loving, of course, but if a kid's anxious about a health issue, then don't bring them to the doctor more than is medically necessary, not even once. And don't look up anything on WebMD. In fact, never look up anything on WebMD ever. Please do yourselves a favor. If a child has OCD and won't touch a door, don't open it for them. Let them suffer with it. Let them deal with it on their own. If a child is excessively shy, don't make excuses for them. Don't make it socially comfortable for them. I'm not saying you have to make it worse. That's my job. I get to be the bad cop. But don't make it better. There's another thing, which is that kids do best in treatment when parents face their own fears. I will tell you in my clinic, we have never had an anxious child who did not have at least one anxious parent. Never. It has not happened. In fact, this is crazy, even when kids don't know or see that their parents are anxious, it can still have an impact on their mood states. I'll tell you a story. Years ago, there was parents of a male tween who called me up. They said, my kid's all of a sudden having severe OCD. So I thought it was maybe pandas or something. I got it ruled out, not even close. No infections. The guy, seemed just sudden onset of OCD. And I spoke to the father privately without his wife present, and I said, I gotta ask, do you have any compulsions? And he's like, how did you know? For years, the guy has had OCD. And not even his wife didn't even know about it, let alone his kids. And his children had no clue, but it happened. Why does that happen? That's a spiritual question, ask the rabbi. Okay, practically speaking, what do we do? Somebody has anxiety. Now, all people have some level of anxiety between low, medium, high. And at some point in time, some people hit their individual threshold, and they say, I can't handle this anymore. So corresponding to those little different levels of anxiety, there are different levels of treatment. At the lowest levels, well, we don't usually treat somebody at all. We will encourage them to increase their self-care, sleep, exercise, diet, better work-life balance. Take a vacation, please. Increase your family time. All of that's great, and sometimes that's enough. We also encourage people to seek friendship and to talk to other people in their social network about how they feel. But it's more than that. Actually, it's one of the key predictors of people doing well is just being able to speak to somebody about how you feel. Now, a little further along the line, maybe that's not enough, the self-care and the interpersonal connection. Speak to a mentor, a Rav, Rebbitzin, parent, grandparent. Chizuk, speak to somebody who's going to help you, encourage you. That's a great source, and it's free, so why not? Next on the line would be Structured Self-Help, an informational book. There are lots of great books. If you need a title, call my office. We're happy to advise you about that. If that's not enough, then we're getting into professional treatment. A lot of people have ad hoc therapy. And don't worry about your neighbors, because they're in therapy too. But ad hoc therapy is once every 4 to 6 weeks, going to a professional therapist, talking about what's on your mind. Minimally invasive, and it's a really good idea for a lot of people. I think almost anybody could benefit from that today, frankly. Who wouldn't like more guidance in their life? More than that, though, we're talking about weekly therapy. Sometimes, though, that won't cut it. And then there's more things that you can do if that's not working. Adding a DBT skills group. I'm not going to get into details of what that is, but dialectical behavior therapy, skills groups can be very helpful. Adding medication, no problem. But sometimes people need something more severe. They need an intensive outpatient program, and that's like 3 to 5 times a week of 2 to 3 hour sessions for a period of 2 to 3 weeks. It's not forever. It's for a period of time. It's a couple weeks, maybe a month. We do have an IOP at our program in the Center for Anxiety, and we help a lot of people overcoming severe levels of anxiety. It's one of the things we specialize in fact. It's both a recalibration, but it's also a crash course in exposure therapy and other things to cope with their distress. Finally, though, if that doesn't work, then there is inpatient hospitalization where people are under 24/7 watch. We try to avoid it, though. Typically, when people come out of the hospital, they're actually worse off than when they went in. But if a person has to go in because of safety concerns, then they have to go, and we will refer people. We hospitalized someone 2 weeks ago, in fact. It happens. We try not to. Typically, it's for people who are acutely suicidal or that kind of thing. So the main question is just figuring out what level of care do we need. Is it self-care? Is it standard therapy? Is it inpatient treatment? And then proceeding accordingly. Everybody in this room and everybody you'll ever meet needs one of the things that I just said. At least one of them. I'm going to conclude now. I'd like everybody here to take 10 seconds. And I'd like you to consider the following questions. How much support do you need right now, to tolerate uncertainty and to accept life as it is? How much support do your kids need if you have children? Even more importantly, if you need help, or you need more support, or your children need more support than you're currently getting, are you actually prepared to go out and get it? Are you going to take the steps that are necessary? If that's calling a friend, great. If it's an inpatient hospitalization, fine. If the answer to that last question is no, and you're not prepared to get it, then please see me after class. Because the tragedy of anxiety is how treatable this is. We do not have to live with it, but so many people don't get the help that they need. And even greater tragedy is how much it grows. It grows and grows. I like to say it's like a mortgage. You can pay it off early with no points, but if you don't pay it off early, if you stop making payments, it's going to get really ugly. Interest only, 5-1 arms, forget it. And given the current chance, there's actually a good chance, given the current trends, there's a good chance that everybody, well, I'm not going to overstate it. I will say this. All of us have to be very thoughtful and strategic and deliberate about how we cope with anxiety. Whether that's on our own, whether that's with friends, whether that's support from mentors, whether that's support with professionals. And should that happen, then I hope and I pray that we'll have the strength of character and the courage to embrace uncertainty and to accept the limits of control over our emotions and to get the help that we need. Thank you very much.